Katie, and I'm going to be your student nurse today, and we're going to be doing a head-to-toe assessment. So I've already done hand hygiene and provided patient privacy, and I've taken the patient's height, weight, and vital signs. Can you tell me what your name and date of birth is, please?
Lindsay Smith, July 12th, 2004.
Okay, so now that you've already told me your name, can you tell me what the date is?
It's in April.
Okay, can you tell me where we are?
My house.
Can you tell me what we're going to be doing today?
Head-to-toe assessment.
Okay, so I assessed your gait as we walked in, and it looks steady and even, so that is good. So we're going to start the head-to-toe assessment by palpating your scalp. Okay? I'm going to do your sinuses, frontal, ethmoid, and maxillary. Can you puff out your cheeks for me? Can you raise your eyebrows? Okay, so can you close your eyes? And we're going to do a taste test. So just lick this. Tell me what it is.
Toothpaste.
Okay, good. So cranial nerve 7 is intact. Okay, so now we're going to move to the eyes. Okay, so first thing we're going to do is test the pupil size. Okay, so they are equal and round at 4 millimeters. So now I'm going to test for light, okay? Okay, so now can you stare off at the wall for 30 seconds? And then when I put the pen in front of you, look at the pen. Okay, now follow it. Okay, good. So the eyes are parallel, the pupils are equal, round, reactive to light, and accommodation. Now we're going to test your extraocular movements. Can you just follow the pen with only your eyes for me? Okay, good. Do you wear contacts or glasses?
Yes, I'm wearing contacts now.
Okay, so because we don't have a Snellen chart here, I'm just going to speak to it today. You would first look with one eye and then the other, and then both at the same time at the Snellen chart, and that would let you know that cranial nerve 1 is intact, and the extraocular movements that I did let you know that cranial nerves 3, 4, and 6 are intact. Okay, so now I'm going to move to the ears. I'm going to inspect the external ears, pulling up and back because you're an adult. Okay, so they look good. And now I'm going to do a whisper test. I'm just going to say a string of letters and words and just repeat it for me, okay?
B12, 7A.
Okay, so now I'm going to do the other.
C6, 5B.
C6, 5B. Okay, so both of the hearing tests were positive, so that means that cranial nerve 8 is intact. So now we're going to move to the nose. Can you include one nostril and blow for me? And now do the other. Can you close your eyes for me? And tell me what symphysis is? Okay, so that means that cranial nerve 1 is intact. So now I'm going to move to your mouth and just assess your oral cavity, your mucous membranes, your tongue, and your teeth, and make sure that the uvula rises midline. And it does. Can you stick your tongue out for me? Okay, so it also protrudes midline. Can you move it side to side? Okay, good. So that means that cranial nerves 9, 10, and 12 are intact. Okay, so can you clench your jaw for me? Okay, so it looks good. No TMJ. Okay, so now I'm going to sharpen dull, so can you shut your eyes? And tell me if you feel sharp or dull sensations, okay?
No. Sharp. Dull. Sharp. Sharp. Dull. Sharp. Dull.
Okay, good. So that means that cranial nerve 5 is intact. And now I'm going to move down to your neck. I'm going to palpate your temporal pulse before I move down. And it is a 2+. And now I'm going to move to your carotid, only one at a time as to not include the blood flow. And it is a 2+. Can you lean forward for me? Okay, so now I'm going to get behind her and feel her thyroid and her trachea. The trachea is midline. Can you follow for me? Okay, so the thyroid also rises midline, and you should not be able to palpate the thyroid unless it is swollen. Can you lift your shoulders for me? Okay, so that means that cranial nerve 11 is intact. Okay, you can lean back. Now I'm going to move down to the thorax. So I'm going to check your skin turgor. I'm going to pinch you a little bit. Okay, and there's no tensing, so that's good. Have you ever performed a self-breast examination before?
Yes, we kind of have more information.
Okay, so you're going to use 3 fingers, but not your thumb, and we're going to do the vertical strip technique. And you're going to start on the bottom on the outside, and you're going to come up and down over the whole breast towards the middle. and check for any masses or lumps. And also make sure that you look in the mirror and you check for any differences in the two or any differences from the last month that you've checked. And you need to look for any dimpling or masses again. And you need to do this every month at the same time, usually right after your period ends. Okay? Now I'm going to move to the heart sounds. Okay. I'm going to do aortic, pulmonic, Erb's point. Okay, I'm going to lift your shirt up, okay? Tricuspid, and mitral. Okay, now I'm going to listen in the same spots again with the bell to listen for any bruits or murmurs. Okay, everything sounds good. So now I'm going to check for any jugular vein distension. Can you turn your head to one side for me? Okay, and now to the other. Okay, and now I'm going to check all of your lymph nodes. Okay, so I'm going to check any swelling, the pre-auricular, parotid, tonsillar, submandibular, and submental, the post-auricular, occipital, superficial cervical, deep cervical, and posterior cervical, and also the supraclavicular. Okay? Can you lean forward? I'm going to check your vertebrae. I'm going to inspect and palpate. Okay, so everything seems straight and midline, so that's good. You can lean back. Okay, so now I'm going to listen to lung sounds. Starting above the right clavicle. And now lift your shirt again. Okay, now lean forward. I'm going to listen to your back. And I'm making sure to fan out as I go down her back. Okay, all of your lung sounds sound good. You can lean back. For continuing the lung assessment, can you lean forward for me? I'm going to do tight perimeter, so I'm just going to put my hands on you, and you're going to say 99 for me, okay? Say it. 99. 99. 99. 99. Okay, lean back. I'm going to do it on your chest. 99. 99. 99. 99. Okay, so now I'm going to put my palms flat and just breathe normally for me. Okay, lean forward. Do it again. Okay, so your chest expanded equally, so that means that your expansion is equal bilaterally, so that is good. So I'm going to assess your AP ratio, which should be 1 to 2 from side to front. So can you move your arms for me? Okay, so 1, and that's the middle, so good. It is 1 to 2. Okay, so now I'm going to move and check your arms, or I'm going to do your Allen test first, okay? So I'm going to get you to make a fist, and I'm going to squeeze right here, and then you're going to release the fist, and I'm going to make sure the patency returns to your palm within 5 seconds. Okay, squeeze for me. Okay, release. Okay, that one's good. Do it again. Okay. Okay, both the radial and ulnar arteries in the right hand are good. They have patency. Like this. Release. Okay, do it again. Release. Okay, radial and ulnar arteries in the left arm are good as well. They have patency. Okay, so now I'm going to just check your arms, just inspect them. Okay, so I'm going to check your capillary refill time, and I'm going to squeeze your fingernail and hope the color returns within 3 seconds. And it does. I'm going to check your other arm. Okay, I'm also going to assess your brachial and radial arteries. Okay, so all of your pulses were at 2+, so that was good. Okay, so now I'm going to move to your abdomen. Can you lay down for me? Okay, can you put your legs down? Okay, so now I'm going to lift your shirt. Okay, so first thing I'm going to do in the abdomen is inspect. I'm going to look at eye level, and I'm going to look for the contour, the shape, and if there are any hernias. Okay, and everything looks good. And then second, I'm going to auscultate in the lower right quadrant. Okay, so all of your bowel sounds are normal. Okay, do you have any tenderness in your abdomen? Okay, good. If you did, I would assess that, or I would palpate that section last. Okay, just gonna do some light palpation. Do you have any tenderness? No. Okay, good. So now I'm gonna assess for distension in the bladder. Is this uncomfortable at all? No. Okay, good. Now I'm gonna listen to your vascular sounds in your abdomen with the bell of my stethoscope. Aortic, right renal, right iliac, and right femoral. I'm gonna lift your pants up, okay? Okay. Left renal, left iliac, and left femoral. Okay, everything sounds good. You can sit up now. Can you tell me about your last bowel movement, about when it was?
Yesterday afternoon.
Did you notice any changes in the color or consistency?
No.
Okay. How about your urinary habits?
About the same as normal.
Frequency?
2-3 times a day.
Okay. What about the color?
Normal yellow.
Is it cloudy or is it clear?
It's clear.
Okay, good. Can you tell me about your last menstrual period?
A couple weeks ago.
Okay. Did you notice any changes in that?
No.
Okay, good. In your perineal area, the hair distribution, any drainage, like have you noticed anything different in the general appearance?
No, everything's the same.
Okay. Now I'm gonna assess your legs. Just gonna inspect them and palpate for any edema. Okay, now I'm going to feel the pulses, the popliteal. Dorsalis pedis. Or no, this is dorsalis pedis. And this is the tibial. Oh, you can't see. This is dorsalis pedis on these, and this is the tibial. And they were all a 2+. That's good. Can you push against resistance for me? Okay, good. Can you also squeeze both my fingers? Okay, so both the hands and the legs were equal in strength bilaterally. Now I'm going to test your reflexes, and I've chosen the tricep and the patellar. So can you sit up for me? And then just give me this arm. Okay, completely relax it. Let me hold all of its weight. Okay, so I'm just going to hit right here, and your arm should have a reflex. Okay, that one is intact. Can you give me the other arm? Okay, give me all the weight. Completely relax. Okay, now I'm going to do the patellar. And I know that you can't really see it because I don't have anyone to film the video for me, but I'm just going to hit her knee, and they're going to be dangling and completely relaxed, and the knee should have a forward swing to it for the reflex. Okay, both of the patellar reflexes are also intact. Okay, you can sit back now. I've assessed the skin as I've gone over the whole body, and everything looks good. There's no abnormalities or swelling. And then I would document all of my findings.